Welcome. My name is Jess Posner. My pronouns are she and they, and I am the director of the Virtual Y at the YMCA of Central New York. It is my pleasure to welcome you to tonight's edition of our September Virtual Y speaker series, Healthy Aging. Tonight's guests are Nikki Boyd from the Global Alzheimer's Platform Foundation and Christine Hall from Clarity Clinical Research. Before we begin, I'd like to welcome you and offer a few announcements. Though we are coming to you virtually and accessible to anyone in the world with access to the internet, the YMCA of Central New York does exist as 8 physical branches, a virtual branch, and 3 camps located in and around Onondaga County in New York State, which stands upon the unceded traditional ancestral lands of the Haudenosaunee Indigenous peoples. As your host, I'd like to offer a visual description of myself. I'm a tall, larger-bodied, queer white woman of mixed European and Jewish heritage who lives with chronic illness. I am wearing a black satin jacket with a red lipstick, some kind of funky glasses and jewelry, and an asymmetrical brown haircut. The background behind me is a wall full of books, as well as some green plants over my shoulder. It is my pleasure to welcome you here tonight. This month, we celebrate Healthy Aging Month with our virtual speaker series featuring 3 free educational seminars focusing on different aspects of healthy aging: financial, brain health, and the law. We are happy to partner with experts who provide introductory guidance, advice, and helpful resources on navigating these issues, whether you're navigating them on your own or helping a loved one. Our first guest last week was Ruth Schwartz, a retired successful stockbroker and fundraiser who offered a very informative and personal presentation on financial wellness. Tonight, we are joined by Nikki Boyd and Christine Hall, who are speaking on Acti-v8 Your Brain health program, which covers the 8 pillars of brain health, including opportunities to get involved with clinical research studies focusing on Alzheimer's and Parkinson's diseases. And next week, the final Monday in September, we will be joined by Sam Ogwum, the Deputy Director of Volunteer Lawyers Projects of Central New York, Inc. VLP provides pro bono legal services for low-income individuals in Central New York. Sam will provide an introductory seminar for individuals and families who wish to learn more about how they can use legal documents and strategies to plan for their future, make healthcare decisions, and more for themselves and their loved ones. So please register and tell your friends. If you miss any of these presentations, we will be uploading them to our YouTube channel and Virtual Y website within the coming weeks. We'll send out those links to folks that registered for our events, as well as via the monthly Y newsletters. So please be sure to keep an eye out for those. We are recording these events, so please know that, but we will only be sharing the feed of myself and the speakers tonight on any of the recorded versions of this event. So I would love to welcome our guest tonight. Nikki Boyd is the manager of recruitment. I'm going to go ahead and spotlight Nikki here. And I'm also going to add Christine, our other guest. Okay, now you should see the 3 of us. Nikki Boyd is the manager of recruitment and clinical trial optimization for Global Alzheimer's Platform Foundation, also known as GAP, and is based in New Hampshire. Nikki began her career in research at a private multi-specialty research center. Focusing on neurology, internal medicine, and dermatology trials, Nikki began working with marketing and clinical teams to enhance recruitment efforts. Most recently, Nikki was the marketing and recruitment manager and has worked as a recruitment coordinator. With GAP, Nikki works with clinical research sites to engage with communities to elevate Alzheimer's clinical trial participation as an option for those with memory loss. Christine Hall has 27 years of experience as a clinical research coordinator in upstate New York. She has been managing memory studies with Clarity Clinical Research for 4 years. Christine grew up in Syracuse, graduated from Lemoyne College, and then went on to UMass Boston and Northeastern University. Christine had 3 grandparents with various forms of dementia, and her family's experiences have spurred her to become part of the solution. I'd love to thank you so much for joining us tonight to share your expertise, Nikki and Christine. And I want to thank extend a great thank you to all of our guests for joining here tonight as well. If you do have any questions for our guests tonight, please feel free to put them in the chat at any time. And then I will share them with our guests following the presentation when it is appropriate. I'll also prompt you again at the end of their presentation. So without further ado, the virtual stage is now yours, Nikki and Christine.
Thank you, Jess. I'm going to share my screen and optimize. Okay, you should see the Activate Your Brain screen. So thank you for the warm introduction. Hi, everybody. Thank you so much for joining us today. We are so excited to be here. September, as Jess said, is Healthy Aging Month, and tomorrow is World Alzheimer's Day. So we just wanted to provide some additional information for you. As mentioned, I work for the Global Alzheimer's Platform Foundation, known as GAP, and our company is committed to advancing clinical trials in Alzheimer's and now Parkinson's disease. And our goal is to accelerate the timelines to make progress in research. So we support over 80 sites in our Alzheimer's and Parkinson's disease network. And we currently work with 11 sites across the US on the BioHermes trial that Christine will discuss in a little bit. So Activate Your Brain is a brain health program developed by GAP, and this is to promote healthy aging and to help decrease symptoms related to Alzheimer's and dementia. The program is evidence-informed and based on research that shows that staying active can help improve your brain health. And negative brain aging has been shown to be related to lifestyle choices and chronic diseases such as heart disease and diabetes. So everything we do impacts our health. But the good news is that we can take steps now. It's never too early, it's never too late to maintain good cognitive health and to be able to age more efficiently. So I have a short little video that gives us an introduction into the Activate Your Brain program.
We all know the basics of keeping our bodies healthy as we age. Exercise to strengthen heart and lung capacity. Keep your muscles and bones strong with resistance training. Get your blood pressure and cholesterol checked. Mammograms for women, prostate exams for men. Healthy diets for everyone. Blah, blah, blah-bitty-blah, right? But think about this. How often do you think about the health of the organ that you actually think with? There are many forms of dementia, including Alzheimer's, a brain disease with no cure or treatments to stop its progression. More people die every year from Alzheimer's than from breast and prostate cancer combined, and that number is going up. That's why so many people fear getting Alzheimer's. It's time to make brain health part of overall health. Having a healthy brain impacts everything: your energy levels, quality of life, overall well-being, friendships, happiness, your independence. And research suggests there are simple things we can do as we age, and we're talking from 45 on, to keep our brains as healthy as possible. The Global Alzheimer's Platform Foundation has identified 8 pillars to help activate your brain and reduce cognitive decline. Some of these are no-brainers. Well, you know what I mean. Stay active. Eat well. Sleep well. Exercise your brain. Connect with friends and family. Relax and reduce stress. Control risk factors. Finally, and this is an important one that unfortunately not many people are aware of, you can get involved in research. Brain health studies are always seeking volunteers. Your participation could lead to breakthroughs that not only help you reduce cognitive decline, but help all of us understand how to keep our brains healthier. Meanwhile, start small. Take a nice walk. Add more veggies to your diet. Join a club. Use the Activate Your Brain pillars to feel better, think more clearly, and stay independent, even as you age.
All right, so today we will be discussing the 8 pillars of brain health. And simply said, we need to make positive lifestyle changes every day to increase healthy brain living. So number 1, stay active. I'm sure that's not quite a surprise to many of you. So research supports a strong link between physical activity and brain health across the lifespan. Being physically active can help you feel better, have more energy, sleep better, and improve your strength and balance. And there are many ways to get physical activity. It can be adjusted based on your needs, your strengths, your abilities. 2 things that stick with me that I heard recently that I just love. One of them was move every day. So it doesn't have to be running a marathon. You don't have to start with some gigantic goal that you're not going to meet. Whatever you do, as long as you're moving every day. And then no matter what activity you do, you're still lapping everybody on the couch. So whether it's parking farther away at the grocery store, or if you want to train for a marathon, find ways to be more active. Number 2, eat well. So the effective diet on optimal cognitive aging has been difficult to study, but reduced risk has been found in studies of the Mediterranean diet, the DASH diet, and the more recent MIND diet. Each of these emphasizes limiting red meat and focusing on whole grains, fruits, vegetables, fish, nuts, and olive oil. The Mediterranean diet consists of eating primarily plant-based foods such as fruits and vegetables, whole grains, legumes, nuts, replacing butter with healthy fats such as olive oil and canola oil, and using herbs and spices instead of salt to flavor foods. So one study that came out was a 900 plus participant study at Rush University in 2015. And that study found that those who stuck most closely with the MIND diet had about a 53% reduction in the risk of being diagnosed with Alzheimer's disease. But even for people who followed it moderately, their risk was lowered by 35%. Number 3, sleep well. Getting a good night's sleep not only makes you feel more alert and energetic, but can also have long-term effects on your health. The risk of obesity, cardiovascular disease, and diabetes have all been shown to be associated with chronic poor sleep quality, and each can contribute to cognitive decline. And likewise, lack of sleep can affect stress levels, decision-making, memory, focus in the short and long term. Chronic sleep deprivation can lead to poorer brain function, potentially making it more difficult to process information, complete tasks, and commit information to memory. Number 4, exercise your brain. Just as your body needs to be exercised, so does your brain. Stimulate your mind with mentally challenging activities such as reading, playing games, doing puzzles, learning new things, taking up a hobby, or volunteering. As you can see, many of the items listed here fall into multiple categories that we've already talked about. Now, there are so many phone apps where you can do many of these things that are designed to train your brain. So any of these activities, however you want to do them, even the volunteering, I heard on the radio recently that there was some long study done and they found that 2 hours a week was kind of like this optimum amount of volunteering that gives you just enough social interaction and a feeling of contributing to something, and it didn't overwhelm people. So that was kind of the sweet spot of how much of your time to share with other people. Number 5, connecting with friends and family. So many studies have shown that across the lifespan, increased social activity is linked to a lower rate of cognitive decline. People who have more social contacts score higher on tests of memory and executive function. And positive, healthy interactions and relationships show a greater benefit than stressful, negative ones do. So many of us tend to self-isolate as we age, but staying active in the world around us can prevent depression and apathy in the future. And close relationships and friendships often lead to more of a support system as we age and health issues begin to take their toll. So staying connected during the past year and a half has definitely been challenging. People have found technology to be helpful by using video chats or messaging and other socially distant methods to stay in touch. But even just picking up a phone and just having a phone conversation is a simple way to stay connected. Number 6, relax and reduce stress. Another thing that's been impacted by COVID. So chronic stress is thought to damage the brain and may cause problems with learning and memory. Mind-body approaches can relieve stress. So again, we see some of the suggestions overlap with the other pillars that we've covered. So doing puzzles, doing yoga, exercising, all of these things also contribute to your body feeling less stressed as you kind of work through those things either physically or mentally. Number 7, controlling risk factors. The risk of experiencing age-related cognitive decline is influenced by age and genetics, but also by factors that you can control by adopting a healthy lifestyle and getting treatment for conditions that increase the risk of cognitive impairment. And these conditions include diabetes, hypertension, obesity, depression. Delay or prevention of serious conditions may affect your brain health. So having regular checkups and being aware of your health is a key factor. Number 8, get involved in research. So Alzheimer's disease is a fatal progressive brain disease that slowly destroys memory and thinking skills. And these symptoms often appear years before diagnosis. In the US, Alzheimer's and dementia deaths increased 16% during the COVID pandemic. And older African Americans are twice as likely, and older Latinos are 1.5 times as likely to have Alzheimer's or other dementia as older whites. So volunteering for an Alzheimer's trial is the best way to receive the latest, most innovative treatments and our world's best hope for developing more effective medicines. And today there are many types of research studies that seek volunteers. There are studies for people that are healthy and do not have any memory loss. There are people that are in very early stages of cognitive decline, all the way up to the mild, moderate Alzheimer's disease. So you can choose a study that doesn't involve a drug, a study that is whatever your needs are at that moment. There's probably a study out there for you. So where can you get involved in research? Clarity of Clinical Research is an independent research site located in Syracuse. And the site is one of our GapNet sites working with us on Alzheimer's disease trials. And when you volunteer for a study, you're joining to fight or prevent Alzheimer's disease and impact the future of medicine. So Clarity offers free memory assessments for those who are just concerned about memory loss. So even if you are just kind of not sure if what you're experiencing is normal aging or if there's something more happening there. And Christine will discuss that with us in just a moment. So I will now turn the presentation over to Christine, who's a research coordinator at Clarity, and she can share more with you about the work that they do. So welcome, Christine.
Well, thanks. I appreciate it. It's fun to see some familiar faces that have joined us for the presentation. I want to talk a little bit more about what Alzheimer's is, as well as talk a little bit about this specific study. I know that there's a wide variety of people that have either done some research on Alzheimer's or are just in the earliest stages of learning about it. But what you're going to see is there is a study that we're doing right now that's called a biomarker study. And I like to talk about that because it sounds like a big scientific word, but there's lots of biomarkers that you all are familiar with. I am grateful that I don't have to use the biomarker to figure out if I'm pregnant anymore or not. I'm old enough that that's not an issue anymore. But there's all sorts of blood tests and other sorts of tests that you're familiar with that help you and your doctors figure out what's going on with you. And with Alzheimer's disease, as some of you may have experienced yourselves, there's a whole lot of people that are starting to worry about whether they may be at a high risk of Alzheimer's or not. And we don't have any real simple, straightforward blood tests, urine tests, that sort of thing. So let's talk a little bit about what we do have in our arsenal to figure that stuff out, and then how this particular study fits in with it. As you've heard before, there are a whole lot of Americans currently living with Alzheimer's. I like to talk just for a minute. When you hear the word Alzheimer's and you hear the word dementia, sometimes you hear them used interchangeably. And usually one of the first questions that people ask me is, what's the difference between them? If I were to tell you I had cancer, your next question would be to me, what kind? So dementia just means that you've got some sort of memory issues and loss going on that affect your everyday life. Well, the most common form of dementia is Alzheimer's disease. Just like breast cancer or lung cancer is a very common cancer. So we tend to use those words interchangeably, but there are more than one kind of disease that can affect how your memory works. The one we're going to talk about in research today is Alzheimer's disease. So it's progressive, it gets worse and worse. When you look at the brain of somebody who has passed from Alzheimer's, there are some things you see. And on this slide, it'll tell you. You see these amyloid plaques, which are buildup of proteins between the nerve cells and make it hard for them to talk. You see these tau tangles, which are shriveled, collapsed, dead nerve cells. And on some scans, you might see parts of the brain that may shrink and that kind of thing. So let's go on and see what's next. Yep. So for BioHermes, what we're trying to do is find some simple, easy, straightforward ways to figure out if you're either at high risk of developing Alzheimer's, or if there's early changes going on in the brain. And so this is strictly a study where we're going to do a whole lot of tests. We're not going to do any treatment or anything like that, but we're going to in some ways, I feel like, you throw enough spaghetti at the wall, something's going to stick. So this study, as you'll see as we go along, is a mix of traditional kinds of memory tests. Here's some words, please remember them, and a whole lot of newer and different sorts of tests. And one of the things that we're testing is we're going to do some blood work and see if we can track what we see in the blood to what we're going to see on a very expensive PET scan. And if that is successful, then that will be pretty cool. So the existing scans that are used, the existing ways we sort of figure out if you may have Alzheimer's, is it's often by word of mouth, talking to families, that sort of thing. Some memory testing, but there are some scans that have been able to show, yep, there's changes going on. The first one is an MRI of the brain. That often can be used to rule out other things that could cause memory issues. And since 2012, there's a new amyloid PET scan, PET. And I explained that usually a PET scan is something you might have run into if people have been worked up for cancer. This is a different kind of PET scan. And instead of looking for cancer cells, it goes to the brain and it lights up amyloid plaques that are building up there. Now, that's a great scan. It's $6,000 to $9,000. Insurance right now doesn't pay for it. And it's certainly not quick and easy and available to everyone. Right now, most of these scans are being done as part of research studies, which may make it even more appealing for you to be involved. And in this BioHermes study, we're going to do an amyloid PET scan of the brain and compare it to some of the blood tests and other things that we're doing to see if we can find some newer, better and simpler tests that would tell us. So BioHermes goes on and you come in to see us twice. The first time is about 4 hours and you come in with a study partner, somebody who knows you well, spends a lot of time with you, and we check in with them to see what strengths and weaknesses they see. Have they seen any changes over the last several months? And their part is about an hour long, and then they're free to go. But as the subject, you're here about 4 hours. We're going to do some traditional memory testing. We're going to check your gait and see how you walk, see if there's hints there. We may record your voice and see if the software systems are able to pick up some changes, early changes in your voice. There's all kinds of interesting new gadgets that we're going to try and see which of any of these things might be predictive of early memory issues. And maybe we can move in the future some of these technologies into doctors' offices and other places. So you come in for about 4 hours, then we send you off to the imaging center up the road at Brittenfield, and we're going to do an amyloid PET scan of your brain. After that scan's done and read, then you come back into the office for a shorter visit, and we will give you the results of that scan. Many of the people that come to see us, the results are negative. There's no early changes that the PET scan is picking up. And for the smaller number that are seeing some early changes, then we can go on and talk about some of the other kinds of research studies that we're doing here at the center that you may be interested in considering. So this is a pretty short study. It's over 3 months, 2-3 months, depending on how quick we can get in and get the imaging done. And you can walk away knowing that for the best way we can measure how your brain is doing right now by this PET scan, you'll know what your results are. So, and hopefully you will be contributing to our overall knowledge and help us rule in or rule out whether some of these other sorts of things we're testing will work. So as you see, the PET scan is done at no cost to you. There is a blood draw both times when you come visit us. You're going to have a chance to talk with our medical investigators, and they'll be able to explain what is seen, if anything, on the PET scan. I can tell you that sometimes as they've been looking at these PET scans, there can be changes starting in your brain anywhere from 5 to 15 years to 20 years before you forget anything. So we'd like to get a lot smarter at picking up these early brain changes. And if we can do it by PET scan, that's great. If we can do it by a blood test, that would be even better. So we're going to look at blood tests to see if what we see on the PET scan matches what we see in the blood that we take from you. And how does that match up to all the memory tests you did in the 4 hours you were with us? So you're really on the cutting edge, helping us to find new solutions for identifying brain issues. So let's see what's next. I'll let you pass the slide along. Whenever you're involved in research, you're going to spend the very first minutes in the office learning all you can about the study and signing an informed consent. Then we go on and give you a study ID. And as information gets given to the sponsor and they learn about your results, you're basically a number. Nobody's going to find out your name, your birthday, and where you live. It's not becoming part of your medical record. It's not becoming part of your insurance. It shouldn't have any effect on any of those things. It's all just by ID. And I like you to know that because, you know, we're dealing with some sensitive stuff here. We're looking to see how well your brain is working. Let's see what's the next slide. So the amyloid PET scan is, you're in a machine, it's a tube, and they're going to spend some time. First, they give you a little injection of that dye and let it do its thing, and then put you in the machine and measure whether any of these amyloid proteins that are in all of our brains, is it starting to collect and build up? And I think we've got a picture or two that can show you some of the images that you see here. We all have some amyloid protein in our brain. So that's why the cognitively normal, or the top lines you see, does have a little bit of white, highlighting there. But as people develop more and more of these plaques, which tend to correlate with more and more memory issues, you'll see that the amyloid PET scans can show much more clearly what's going on. And what's wonderful about having this tool is, as we try new diets, new medications, new lifestyle changes, we can track by using this and other things as to how successful some of these potential treatments are. So this is the kind of thing. The BioHermes study's been around a little bit. It's the response has been overwhelming. It's getting a lot closer to being fully enrolled, but we're still desperately looking for people that would like to be involved, especially at this point. At least 20% of the people in the study need to be part of some smaller ethnic groups. And so the study will keep going and keep going until we can find all of the specialized people and help us learn about everybody, not just people like myself. So if you have friends or family that are particularly part of some minority groups, we'd love to see you. In general, we do some wonderful memory testing, but it tends to be now in the, when you come in for a particular study, if it looks like this is a study that you would fit into, the memory testing is part of being part of these studies. So there are times we don't have anything that might be open specifically for you, but it's great to make contact with us. And as things change and open and come along, we're able to stay in touch with y'all. You'll see that one of the things we don't understand is why there's such large variation in the likelihood of getting Alzheimer's disease. And so BioHermes is hoping to nail down the best way to test these things and the best way to pick up these early changes. And we're not exactly sure whether some of the tests that we're developing will be as effective and pick up as many people in all of the different groups that are here. And that's why it's really important. What you're going to see here is, this is our phone number. We are in East Syracuse at the corner of Kirkville and Fly Road. I encourage you to either email us or give us a call. We're happy to talk through what you might be interested in participating in. As I said, this BioHermes study is open to people with healthy memory, to people that have some early memory concerns, and people with some early Alzheimer's diagnosis. So I'm grateful for the opportunity to say hi, let you know we're here, and we'd love to be able to follow up with you in person and by phone. So feel free to give us a call, and we promise to get back to you as soon as we can. I guess I'm done.
Wonderful. Thank you, Christine. Jess, do you have any questions or anything that we can go over?
I do. Would you mind just stop screen sharing at this point so we can see each other a little better? There we go. All right. All right, so I do have a few questions, but first I just want to say thank you so much. Thank you for sharing this information, both about Activate Your Brain and also the current trials that you are working on. It is really interesting to hear all of this information together. And also, I would say quite inspiring to know that one of the things that we can do as we age is to participate in these clinical research studies to help us not only individually get access to some of the most cutting edge research or processes or treatments, but to also contribute in a larger way to help us understand where these things are coming from in a global context. So, you know, it's pretty cool to have all of that presented together. So thank you so much for your time tonight. And I did have a few questions come through that I am going to present to our presenters, but I would also like to encourage anybody else that has any questions to please go ahead and type it in the chat, and I will read those out to our presenters as we move through them. So first, we've got a few questions sort of around amounts. So this has to do with the Activate Your Brain information. So one being the first one, I would say, what is a small amount of red wine? You know, so it says that like a small amount of red wine is healthy for brain health, or is good for that. But, you know, like, is that like 2 glasses of wine? Is it 1 glass of wine? You know, like, you know, what are we talking about in terms of this? And then generally, could you talk a little bit more about what the impact of alcohol has on brain health?
Sure. So yeah, I think, you know, everyone has their own interpretation of what moderation is. And I think the key to many of these risk factors that we can control is moderation is the key, right? So sure, it's healthy to have a glass or 2 of red wine a day. It's absolutely healthy to have dark chocolate. I love that. You know, if chocolate is on the table every day, I will eat it. But that doesn't mean we should eat, you know, gobs of chocolate cake every day. Like my son would love to. So I think that's just kind of the key is just, you know, 1 or 2, it's all relative of, you know, sure, there's going to be a night out that we have with friends where you may have, you know, a few more drinks than you normally would. There may be, you know, days that you go by where you don't have any drinks. So it's all about, you know, having that moderation in your life. But I think that everything that we do, it does impact our health in a lot of ways. So, you know, we hear all the time, eat healthy, exercise. And it doesn't have to be trying to change your life all in one day. We're going to go on this diet. I think, you know, we all tell ourselves that January 1st, we're going to go on this diet. We're going to do all this stuff, but it just takes changing some little habits. So getting to bed an hour earlier than you normally would, you know, maybe not having 2 glasses of wine and just having 1. So it's all about moderation and all of these things. It's difficult to see that in the long run they do impact our brain health. But I think we all know, you know, especially those of us that are moms, that, you know, when you have a baby and you're not getting enough sleep, you know, your brain is not functioning right. So over the long term, not getting enough sleep on a regular basis, that's going to impact your brain in a heavier way. So some of those, I think they make sense intuitively, but there are things that we can do that we can see the benefits of, you know, like when we have diabetes and we change our diet and we start to see our A1C numbers go down. Those are easier, they're more tangible, but all of these things that we can do on small scale to impact our health every day in the long run will impact our brain health.
And if we're talking about research in particular, each research study has its own sort of set of guidelines as to who would be a good fit for the study. And we look at things like overall health, what sort of medicines and supplements you're taking. We do ask questions about if you're smoking or if you're using alcohol, and what kinds and what amounts, because we want to make sure as you get involved in research that whatever you're doing is a good fit for what's going on in the rest of your life. And for most memory sorts of research studies, yes, it's a little bit different between men and women, but usually more than a couple of drinks a day can rule you out of being eligible for some of these research studies. So that's another thing to think about. And I think, you know, each study is different. I've seen 2 or 3 drinks a day for men and 2 for women, but that's really on the high end of what any of our providers would suggest is a healthy thing. But it is good to know that depending on what study you're interested in, what you do in the rest of your life might help you be a good fit for it or not. Doesn't necessarily mean you're sick. It just means for the study we're talking about, it's just not a good fit. So we ask all of those sorts of questions. And yeah, the higher numbers per day or per week can sometimes be problematic.
Thank you so much, Christine and Nikki. Related to that, Nikki touched on it just a little bit, was around quality and quantity of sleep. So there was a specific question that came in from Elizabeth that asked how many hours of sleep is recommended in order to sort of like meet that pillar. I also wanted to ask a question based on that slide as well that said limiting naps to 30 minutes a day. So I was wondering if you could talk a little bit more specifically about how much sleep we need, also like how much sleep at one time, and what's the rationale behind that idea of limiting naps?
Well, I think that the rationale behind the naps is that if you are you're sleeping too long in the afternoon, say you took like a 3-hour nap, then that kind of interrupts your body's wake and sleep cycle, that you may not be ready to go to bed at night when you're supposed to. So, you know, we all have this circadian rhythm where we're at nighttime, our body knows when it's getting dark that we should be getting ready for bed. So they recommend doing things like dimming the lights in your bedroom, closing the curtains, so that your body is intuitively knowing that it's time to start slowing down so that you can rest. As far as the exact number of hours per night, I think it depends on the individual. There are some ranges that they say, you know, they talk about like teenagers needing like 14 hours of sleep. I'm like, what? You know, I don't think I ever slept that long, and I wish I could sleep that long. But I think, you know, the general adage of 8 hours a night is a good recommendation still, but it also depends on the individual. Some people function at 6 hours of sleep. Some people function needing 10 hours of sleep. So I think whatever habit that you have, as long as you have a routine and you feel well rested in the morning, then that means that your body is performing the way it needs to. If you're getting 8 hours of sleep and you're feeling overly groggy, that might be too much for you. So it really is an individual need. There's no, you know, sweet number, but I think that the general adage of 8 hours of sleep is still probably a good recommendation.
I think the other thing is that consistency of when you wake up and when you go to sleep is something that your body really appreciates. There's no such thing as sort of catching up on the weekends or that sort of thing. So I think, you know, with your doctors and lifestyle coaches and other things, you can find a sweet number, but finding a consistent schedule that works for you is really important. To have a different schedule on the weekend than you do during the week can also really wreak havoc with the quality of your sleep and how you feel. So, but yeah, there's a whole lot of wonderful things to research about sleep for sure.
Thank you so much, Nikki and Christine. We had a question also from Elizabeth asking about gait changes. So her question was, when are gait changes seen? And I was curious if you could speak a little bit more about this and how it might be used as an identifier.
We'll see what Nikki says, but I think we're really in the earliest stages of some of this stuff. So we're really looking at what are the kinds of things we can measure, and is there something valuable to be learned from those things? It's easy to record your voice. It's easy to put a phone in your pocket and watch you walk down and have it record things as you walk down the hall. It may turn out that some of those things don't correlate well with what we see on the traditional memory tests or what we see on your PET scan. I'm not sure that we've got a lot of those answers. I think there's a lot of hints, and which is why it's worth putting into a study to see what we can find. Maybe you can say more about that, Nikki, but I think this is sort of ground floor. What do we think is going to help us figure this out? And I'm not sure we've got a lot of solid answers yet, but y'all are going to help us figure those answers out.
Yeah, one of the great things about research that, I've learned in the last few years is just there's so much information about clinical research that people are just so, they're not given all this information. I came into this industry, I had a background in a completely different industry, and I feel like I was just a sponge when I came in. Like, I just wanted to read everything. I just found it so fascinating. There's so much information that I feel like the general public does not have. And what's interesting about research is that every research study, they're coming at it from the scientific point of view of what can we learn from this particular thing. So the study is built around that. What are we trying to accomplish? What are we trying to learn? So like she said about the gait, there's so much with movement disorders that we're still trying to figure out, which is why, GAP is now getting involved in Parkinson's, because it's so similar to Alzheimer's. You have a lot of overlapping symptoms, a lot of overlapping medical history that is there. And so they're very connected. And so the research studies are trying to get in earlier. How can we detect these things earlier? And like Christine said, the gadgets. So having somebody do apps on a phone or having a device like a glucose meter on your arm, all of those things go through clinical trials. So people have to be brought in and given the information and participate in these research studies. So I'm sure everyone is aware of aducanumab that was just approved for Alzheimer's, the first drug to be approved in eons for Alzheimer's. That is huge. And that is because of clinical trials. People participated in these studies. And the studies that were done for that particular drug, they lasted a few years. So this is a big commitment that people give because they're either experiencing Alzheimer's disease and they want to benefit from these new treatments that are not available on the market, or they want to contribute so that they can help future generations. So they know that they have Alzheimer's disease and there's no cure, but they know if they participate, then they can impact future generations and help move science forward. So the BioHermes study that we're working on with Clarity, the whole goal is to help advance research to a point where faster and more cost-effective tests can be more broadly used, because not everyone has access to a PET scan to even get on this new Aduhelm drug, because that's what it takes to become diagnosed to where you qualify for that medication, and Medicare doesn't pay for that. So how can we look at all of these tests that are currently in this marketplace and being used in different trials? How can we just compare them against each other to say, what is the best way to get somebody a diagnosis, to help somebody, like Christy said, in the doctor's office? Are there things that we can involve, in a clinic so that people have access to this kind of information? Because regular doctors are referring patients to neurologists who have so many patients, and it just takes so much time. So how can we kind of take what we know and say, what's the best course of action? So I know that was a really long answer, but there's so much about research that I really love sharing with people, because it's just this whole other world that people just don't really know is there. And I love that, if there is any kind of silver lining to COVID, is that it kind of pushed clinical research into the forefront of the conversation, with having all these vaccine trials, that people are aware of how impactful clinical research studies can be.
I wanted to let you know, just in general, there is a site that you will eventually be able to read the results of this study. It's called clinicaltrials.gov, G-O-V. And it's not necessarily the most touchy-feely, wonderful site, but every research trial done here in America has to talk about what their study's about, what it takes to get into it, what locations these are going, they're available, and when all the analysis gets put together, which can be 2, 3, 4 years after the study ends, the results have to get published. So I think it's nice for y'all to know that we're trying to shine more and more light on both the positive, amazing, wonderful clinical trials that make a big difference, as well as those negative ones, because you learn what doesn't work or what doesn't help as well. So we don't have all those answers now, but we will have them, and we're required and are grateful to have the opportunity to publish those results in a place where everyone can search by the name of the drug or the name of the company or the name of the study. So that's clinicaltrials.gov. So what else you got for us?
Well, that's more or less it. So I, wanted to ask both of you, actually, in the few minutes that we have remaining, if there was anything that you would like to share as a closing thought. I would love to say just thank you to all of our participants. I do have an informational flyer from Nikki and Christine that I will be sending out to everybody that registered for this event that has information about how to contact them. If you would like to get involved and to learn more. So that will be coming into your inboxes in a few minutes after we log off together. But before we do that, Nikki and Christine, would each of you like to offer just some closing thoughts or anything you'd like to leave us with this evening?
I just want to say thank you, everyone, for attending. I love that Christy knew some of the people that are on the call and that some of the people on the call knew each other. I think that's great. I don't know if you're just part of the YMCA community, but I'm just so happy to have the opportunity to join the call with Jess and Christy. I love working with Christy at Clarity Research. I visit them probably once a month, and I will be there this week, actually. And they just do such an amazing job. They have so many research studies that they're doing, and several that they have been recognized from these global companies on how well they've done. And it's just such a pleasure to work with them. So just happy to be here and share this information with everyone. Thank you.
Well, goodness, my head's large, but thanks for all those kind words. I do want to say that, pretty much any medicine that you take now, someone was part of a research trial before you were allowed to take it. And that up to 80% of research trials looking at memory issues have trouble enrolling volunteers. Some memory studies never get completed because there aren't enough volunteers, and some actually do, but may take 2, 3, 4 years longer than they want because there aren't enough volunteers. So in some ways, since y'all have signed on, we're singing to the choir because you're taking those first steps to get the information. But in any way you're able to encourage your friends, your family, your social circle to be part of research, whether it's memory research or another chronic illness that y'all are dealing with, there is just a huge need for people willing to take the time to help us learn what works and what doesn't. And I can't do my job without y'all. So please come, please call, and together we can hopefully figure this out sooner than later. Thanks very much for the chance.
Thank you so much, everybody, for a really informative evening. It's been really eye-opening, and please look out for that email with the flyer with more information, and also my email address, which you can contact me with any questions that you have, and I'm happy to relay them to Nikki and Christine as well. So thank you so much, everybody. I hope you enjoy the rest of your evening, and I hope to see you again next Monday with our guest, Sam Ogwang.
Thank you.
Good night.